Hi, I'm Dr. Johnny. Thanks for joining me today. Let's tackle this tough topic today. The most dangerous plastic surgery procedure available today, and it's sought after. A lot of people want it. It's trending. Kim Kardashian is probably one of the first to start the trend. Clothing has become conducive to showing off larger midsections, larger buttock area. It's the Brazilian butt lift with fat transfer. We're going to talk about it today, what it is, why it is. It's a real quick clip, but also I'll offer a couple alternative treatments that maybe you could do instead. And I know that people do want surgery because you can move fat from one area to another. It seems like the best thing in the world. Take it from where you don't want it, put it from where to where you do, and at the same time, be in style with a BBL, the Brazilian butt lift look. Let's dive into it in this Raji's Quickie, 3 seconds. Okay, so the Brazilian butt lift involves taking fat from other areas such as the love handles, we don't want it there, the back, don't really want it there, the bra fat, and the abdomen, and moving it to where people do want it, that beautiful looking BBL buttock. Okay, once you move fat, then the fat has to take. Just like we talk about fat transfer in the face and why I don't do that, it has to revascularize, and if it doesn't all take, it can look irregular. On the body and the buttock, not so important because we don't need all of it to take. If a good portion does, if it's not perfectly smooth, at least you have the great shape and you can fine tune it afterwards, sculptor and different things. However, it has other downfalls, and that is death. And the reason it happens is when you take fat, fat can form what we call like an embolus. So a little piece travels up to the lung. It's not conducive to living when you can't breathe, if you think of it that way. And it's a common cause, one of the top causes of death and trauma and different things would be what we hear, pulmonary embolus. Similar to something as if you had, people often know if you had a leg vein problem or DVT or deep thrombus in your vein, and the risk of that above the knee particularly going to the lung and then causing death. If we take fat and we put it into the vessels that typically lie underneath the gluteal muscles to the deeper planes, and it goes into the vessel, the same thing happens and it's instant death. Not a good thing. So what can you do about it? Well, you can keep the fat above the muscle. Not everyone likes the look of that, but it does keep it safer. When you go to conferences, this is what people are bantering back and forth, debating who should be doing the procedure. You want to go to a board-certified plastic surgeon who does this all the time. Some of the worst things you hear are people going to centers or places that are offering specials and they're running many people through a day. It's sought after. One of the reasons that made me do this video is because we see bad filler placed in the buttock. And over in Europe, they took fillers off the market that came in 50 cc amounts that were being put in buttocks because of the dangers of them. Well, even worse, people are putting Fix-A-Flat, people are putting silicone, and just, I can tell you, absolute disastrous look. You can almost never get rid of it fully. There's necrosis, death of the tissue. It's ugly. So if you don't want to have, what's the death rate? 1 in about 1,400 to 1 in 3,000 would be the number of people who get the procedure don't make it through. That's an extremely high number of it for a death rate. So if you don't want to take that on, what can you do? And I would submit this is one of these cases where be reasonable. We all want to look great. We want to look refreshed, but some things just aren't worth it. So if you, unless you're doing this for a living, you're making a lot of money or you're really pushed to do it, you might consider other options, or at least have a great consult, go to a great surgeon and know your risks that apply to you given your health history. So what can you do? Sculptra, it's expensive. It's best for people that don't have a lot of fat, but I like it. It's smooth, works for the hip dip. It looks great, and you can go and undermine the cellulite and smooth the legs. It can be done after this surgery, but it can also be done in lieu of, just be mindful. If you want a larger buttock, that's expensive. Doing 50 to 100 vials of Sculptra, very expensive. Your fat is much cheaper. So people come to me for Sculptra BBL. If they have fat, I send them to get fat first. I talk to them about fat first. Other things you can do, of course, there's exercise. Don't want to bring this up to get over into a heated discussion, but squat after squat. There's muscle stimulating devices such as M-Sculpt and knockoffs of those. Cool Sculpting, which was Zeltiq, now owned by Allergan. They have one out, Cool Tone, that is similar to M-Sculpt that stimulates the muscle to move. I don't much buy into that. I mean, you get 5 or 10%. It's like a TENS unit. Some people love it and they're going to argue with me. It's fine. It's nothing that I offer to my patients for the cost, the amount they have to come in for the result they're getting. Doesn't work out for my patients to do that procedure, but it's out there and you might like it. You can research it. Reducing the fat with radio frequency, removing the fat above the buttock. And you can do that with Cool Sculpting. You can do it with injection lipolysis. I have videos on Kybella. Can give the buttock a rounder look because you've taken the fat from above it, which is exactly what you do in a BBL surgical procedure, remove fat from above, and it gives a better look. So those are some of the things that you can do to get a great looking buttock without surgery. But I want you to be aware of the high death rate. See a properly trained physician and understand and go into it knowing everything you know. Most importantly, don't get cheap fillers. It sounds like a quick fix, but it's a disaster. Tell me what you think about the BBL. Do you want to have that look? And how would you like to go about getting it? What have you done? Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.